Dr. Karan Thakur, Global Head Sustainability, ESG and Public Affairs at Apollo Hospitals Group. Thank you so much for stopping by for this quick interview. Let's talk about sustainability, the buzzword in our industry today. What are the key sustainability initiatives that Apollo Hospitals is currently undertaking?
Thank you for having me. I think sustainability, as you said, is a buzzword, but it is also a very important part of any organization, any responsible entity that wants to give value to its customers, and in our case, its patients. What we have been very carefully embarking on is both a project on seeing how do we reduce our carbon footprint, and the step one to that was to actually get an emissions inventory. We are very happy to state that we are amongst the first hospital groups in the world to have the largest cohort of our scope 1, scope 2 emissions, which are charted out. So this gives us actionable intelligence now to act on those numbers. Number two, we have embarked on an emissions reduction strategy, which includes driving energy efficiencies through things like looking at our HVAC systems, LEDs, and also more sustainable design and green design. We feel that through the steps that we're taking on the engineering side, we would be making a significant impact on our carbon footprint in the years ahead. The second has been on our waste generation and waste segregation. We're very happy to state that we are 100% waste segregating on site. Yes, considering that our waste, some of the waste is actually quite infective. We are still not zero to landfill, and we don't ever foresee ourselves to be. But at least where we can make an impact, we are doing that. Third is on our water. All our hospitals have STPs and ETPs. We are regenerating and reusing upwards of about 65% of our wastewater. And we feel that through these contributions, not only are we powering towards carbon neutrality, but actually head towards net zero in the years ahead.
Now that you've spoken about these initiatives, can we also talk about the impact these initiatives have in terms of reducing the carbon footprint of at the hospital?
Yes, so our energy intensity that we've seen over the past 5 years has remained stable, which means that even though our footfalls have increased, we have actually added capital infrastructure, which includes new medical equipment, which is more energy intensive. We've done so in a way that our carbon intensity has not gone up on a net to net basis.
Okay, that's commendable.
Yes, similarly, our water usage, we used to be reusing a lot of our water. And that was close to about 30%, and that has now moved to 55% for our large facilities. The other big place where we have made a big impact is on our sourcing of renewable energies. We were at 7 to 8% a few years back. Some of our larger facilities now are sourcing about 35% from renewables, and we have phased out all sorts of more harmful high carbon intensive fuels and move towards LPG and CNG, and we're hoping to phase them out also in the years ahead.
Okay, that's wonderful. That's wonderful. Can you also talk about Apollo Hospitals' collaboration with other organizations to promote sustainability? Because Apollo Hospitals at large is looking at sustainability in a longer term.
Absolutely. If you see what we've done at our Apollo pharmacies, where we are dispensing all medicines that come to us, and that's close to about 1 crore that we are filling out every year. Each of those packaging has moved now to a biodegradable, compostable material. So that is thanks to our suppliers who've been very forthcoming, on that front. Similarly, if you look at what we've done in terms of collaborating with industry partners like UpDapt is one example where we've been actually doing inventory, emissions inventory. They've been helping us in scoping out our emissions and also then working towards targets. We believe as the end user of products, we will need significant help from the industry to create new medical products which are safe both for clinical use and are also ecologically safe when we dispose them in the years ahead. So we really appeal to more and more people to reach out to us. We're happy to collaborate and devise safer and greener healthcare for the years ahead.
I'm going to leave you with one last question. What advice would you give to other healthcare organizations who are looking to improve their sustainability efforts, just like Apollo Hospitals?
Thank you. So I think first and foremost, we've got to measure. If we don't measure what our current sustainability and carbon footprint is, I don't think we'll make any meaningful improvements on the footprint. Second is the need to collaborate. I think the days of being closely knit and closely bound with what you're doing is over. The need for transparency to share knowledge and capacity build will be important. Third, I think healthcare needs to be at the forefront of the climate change agenda, and I think we need all players, whether public, private, government, non-governmental, NGOs, to work towards creating more awareness around how climate change is impacting human health. Because I believe climate change is a human crisis, human health crisis. I'm looking forward to working with everybody in the field to make sustainability a reality for healthcare.
Healthcare to be the forefront. That is the key word we are leaving Dr. Karan Thakur with. We have much more for you from Polymer Update. We're just starting with the conference. More stories, more interviews lined up for you. Stay tuned to Polymer Update.